At the risk of getting canceled, I'm going to talk about it. Natural birth versus epidural birth. There are a lot of myths about epidural side effects, long-term, short-term for you, for your newborn. And with so much bad information, how are you supposed to make an informed parenting decision? Well, stick around because by the end of this video, you will know the top epidural pros and cons so you can make the decision that is right for you and your upcoming birth. But first, my name is Maria. I'm a Lamaze certified childbirth educator and owner of the app Natural Birth by Echo, a free resource with all of the tips and tricks you need to make your unmedicated birth a positive one. With that, let's get into it. The most obvious pro of getting an epidural is pain relief. It is the most effective way to reduce pain during childbirth. Some women get their epidural and literally sleep through labor, and then they wake up when they're ready to push. And for a lot of women, this is the ideal. Birth seems scary, it seems unmanageable, they've heard horror stories, or they've even been through traumatic births themselves. In such cases, the epidural can provide not just physical relief, but also mental peace. They're not stressed out, they're not dreading labor for 9 months because they know they're gonna have that relief. Other times, a mama wants to go natural, but she gets in there and for one reason or another, she grows distressed. She's overcome with fear, with anxiety. She isn't coping with the intensity of her contractions. In other words, she's suffering. While labor can be physically uncomfortable, it should never, ever cause you to suffer. Suffering gives rise to trauma and ultimately detracts from how you function as a mother. So the two biggest pros to an epidural are that it can eliminate pain, and for some mothers, it can alleviate suffering as well. Another pro is that in some rare cases, an epidural actually helps labor to progress. Now, this is rare because typically an epidural interferes with your body's production of oxytocin, which is the hormone responsible for contractions, so less oxytocin, less effective contractions, slower labor, usually. But sometimes, if the mom is super stressed, she's anxious and her stress hormones are shutting labor down, then an epidural can help her to relax just enough to regain composure so labor can proceed. This is not most women though, it's a balancing act because for most moms, labor will slow down after an epidural is placed. Okay. The final pro of an epidural is emergencies. It can help in an emergency situation if mom or baby go into distress and a C-section has to take place immediately. Having that epidural already in place helps everything to go more smoothly. On the flip side, having that epidural can often be the cause of those very emergencies, which leads me into the cons list. There are a lot, but these are the facts and you deserve to be able to make an informed decision. Okay, the first downside of an epidural is that it often leads to emergency situations, like I just mentioned. And this can be quite dangerous for your baby and for you. As I mentioned earlier, the epidural interferes with your body's production of oxytocin. Not only does this slow your labor down, making you more likely to require a C-section, but it can also cause damage to your baby's brain. Let me explain. Your contractions are actually pretty scary. Each wave squeezes the baby and deprives them of oxygen, which is terrifying. Fortunately, your brilliant body releases oxytocin, which then goes on to produce beta endorphins. These beta endorphins protect your baby's brain from the temporary oxygen deprivation of each contraction. Your body wants your baby to be safe, and it is naturally providing this fortress to protect your little one during labor. However, remember that an epidural lowers oxytocin, which then lowers beta endorphins, so your baby's brain does not have this extra layer of protection and they're exposed to the dangers of oxygen deprivation. During each contraction, they are gasping for air, making them much more likely to go into distress, which means a C-section for you, a 9% increase in the chance of a NICU stay, and don't hate me, a higher chance of exhibiting autistic tendencies down the road. Yes, a 2022 study did find that the epidural contributes to autism, and I will link that below because I know you're going to want to fact check me on this one. It's true though. Now, the study does not explain why epidurals are associated with autism, but Dr. Stuart Fishbein has a really good theory, and I think this is the best explanation I've seen. He says that as the baby goes through each scary contraction, mom's oxytocin, the love hormone, reassures the baby, letting them know that they are safe, they are protected. However, when mom's oxytocin is lowered by the epidural, this scared, confused little baby goes through something really quite terrifying, and mom's not there. They then start to dissociate, which contributes to the behaviors we commonly associate with autism spectrum disorder. Now, it's not a one-to-one. Every epidural does not cause every case of autism, but as the data shows, it is a contributing factor. Okay, the next downside of an epidural is poor bonding. Back to oxytocin, if the love hormone is lowered, then that primal instinctual bond between mother and child will unfortunately be reduced as well. Women often report that after receiving an epidural, it takes about a week or so for their baby to wake up and start to recognize them. This is because the fentanyl contained in a typical epidural is 25 times what is considered safe for a newborn, and it takes time for these drugs to leave their system. Whereas with natural birth babies, the bond is immediate. And from personal experience, when I had Josephine, no, I did not have an epidural, but I did have Pitocin, which it has similar effects on bonding. So for the purposes of this story, they're the same. And I hate admitting this because I love my daughter so much, but it took me several days to feel any kind of connection with her because we were drugged up. Our natural bonding hormones just didn't work as well. Whereas with Colby, it was a home birth. I didn't have anything whatsoever, and the bond was instant. It was powerful. Not to mention the day-to-day little annoyances like waking up at night, painful breastfeeding. These were all less of a chore because my primal nurturing instincts were wide awake since day one. Turning the attention to your baby, bonding is huge for them. It sets the foundation for their long-term mental health, cognitive abilities, success in school, and you really start seeing this early on. Women who get the epidural report more crying, more inconsolable behavior for as long as a month after birth. And these ladies are breastfeeding. They get the golden hour. They're doing everything right, but their babies are exhibiting poor behavior because the comfort of that bonding hormone was not available to them when they needed it most. Okay, we just went through a whole lot of cons for the baby, but let's not forget about you, mama. Turns out the epidural has some serious consequences for you as well. Let's start by going over what happens when you get the epidural. First, the area is cleaned, then you're given a local anesthetic. This is because the epidural needle is a big one. It's like a knitting needle. No, it's not that big. I'm just kidding. But it's big though. So once you're numb, the epidural needle is inserted into the spine and a flexible catheter is threaded through the needle. The needle is then removed, leaving the catheter in place so opioids can be administered throughout the course of labor. It takes about 20 minutes for the painkillers to work. However, once they are in, you are now 30% more likely to require a C-section. This happens for a couple of reasons, and in case you didn't know, these surgeries are dangerous. They come with a lot of side effects for you, for your baby, and C-sections should be avoided whenever possible, but I digress. How does an epidural contribute to your likelihood of needing a cesarean? First, it lowers your blood pressure, and not in a good way. When your blood pressure drops too low, too fast, there is then less blood flowing to the placenta, which means less oxygen to your baby, making them more likely to go into distress and require an emergency surgical delivery. This happens all the time. Another reason why an epidural ups your chances of a C-section is because it prolongs your labor. The epidural keeps you from moving, which slows labor down, and it also lowers your oxytocin, which really slows labor down. Your contractions aren't as effective, baby is stuck because you can't move, and doctors are only willing to wait for so long before labeling your birth as failure to progress. In fact, failure to progress is the top reason cited for C-section deliveries, and many of them start with an epidural. That being said, a lot of women get the epidural and avoid a C-section. That's great news. What they won't avoid is vaginal tearing. With very few exceptions, women who get opioids during labor will have moderate to severe tearing. And I'll tell you a story. I was planning my first birth. I was gonna do it naturally, but I was terrified to tear down there. I asked my doula, how do you handle this at the birth center? And I'm so scared, what do you do? And she said, we don't see tearing at the birth center. You don't see any tearing at the birth center? No. Not really. If we see any damage to the skin, it's usually just a skid mark. Doesn't even need stitches. I was shocked. She went on to explain that in a normal epidural-free birth, the discomfort of labor guides the woman to move in such a way that her body naturally eases the baby out with minimal damage. Tearing occurs when medicated women are completely numb down there, they're flat on their backs, and they can't respond to these instincts, so the baby is forced to rip his way out, leaving them with a hideous tear and a very painful recovery, which leads me into the next downside of an epidural: long-term pain. Many women experience long-term perineal pain, pain during intercourse, bladder control issues, and they laugh it off saying, "Oh, I had a baby, that's just what happens." But these things are not normal. They're signs that something is very, very wrong. Just the other day, I was speaking with a mom who had chronic back pain after her first birth because the anesthetist misplaced her epidural, and for months, she could hardly enjoy her baby because the epidural site was still in so much pain. And you bet that her next 2 births were all natural. She was like, "That epidural caused me more pain in the long run. It wasn't even worth it." And this is actually super common. One study suggests that as many as 31% of women experience recurring back pain due to the epidural. So a lot of the time, the epidural only increases the very pain it is intended to alleviate, which leads me into the next con of an epidural: sometimes it doesn't even work. This happened to my cousin. She got her epidural and 20 minutes later, nothing happened. Another 10 minutes pass and the medication has paralyzed her bottom half, as it is supposed to do, but the pain is still there. So she's just in agony. She can't move. All she wants is to rock and sway according to her instincts, but she's completely stuck, unable to respond to her body's cues as her baby rips his way through to the outside world. She had extreme birth trauma, and you bet she is a huge home birth advocate now. It's actually pretty common for epidurals to fail. The rate is about 10%. Most failed epidurals will get replaced, but sometimes, as in the case of my cousin, the meds just don't work with your body, or it'll only work on one side of your body. I mean, it's weird. Weird things can happen with the spinal cord, and it can be very unnerving to be paralyzed like that, which leads me into the next downside of an epidural: loss of control. Research tells us that losing control is one of the top reasons why women suffer from long-term birth trauma. A huge study was done on thousands of women all around the world that asked this question: why are 45% of women walking away from their births traumatized? We have modern medicine to take away the pain, so surely less pain equals a good birth experience, right? Nope. The data found that pain, length of labor, how long you push, it's all irrelevant to whether you have a positive experience or not. The factors that truly count are emotional. Was I in control? Was I supported? Was I treated with respect? Unfortunately, with an epidural comes the loss of control and the surrendering of your birth to somebody else. And this is tragically leaving many women vulnerable to disrespect, a provider who takes advantage of them, non-consensual touching or cutting. That happened to me. These women are largely medicated, they're not feeling pain, but they are suffering the ill effects of a system that is profit-based rather than parent-based. An epidural will strip you of your autonomy, so if you do choose this route, which I 100% support doing what is right for you, but please, I am begging you, vet your birth team carefully. The next downside of an epidural is pushing. Remember that the discomfort of labor it's not a bad thing. It is designed to guide you to push in such a way as to ease your baby out. But when those sensations are numbed, you can't push according to the design. Your pelvis is closed by up to 30%, which is why pushing with an epidural lasts an average of 3 hours longer. It increases vaginal tearing, like I mentioned before, and because it goes against the design, you are far more likely to need an assisted delivery, the vacuum, the forceps, or a C-section. Your baby is also more likely to go into distress because the pelvis is locked and closed, so it disrupts their movement downward through the birth canal. It's like squeezing a brick through a tube of toothpaste. Like, this just isn't the design. In contrast, pushing without an epidural allows for greater bodily awareness. You can intuitively respond to the sensations of labor and push your baby out far more safely, far more quickly, and without interventions. This is all really, really scary, but there is still one more downside to an epidural, which comes after the birth is over: breastfeeding. Breastfeeding, with all of its benefits from a higher IQ to better bone structure, breastfeeding takes a huge hit. What happens is this: the epidural makes your baby drowsy. It takes them about a week to fully wake up to their surroundings. They're tired, they don't latch well, they're more cranky. They're drugged up, right? As for the mother, an epidural can cause delayed onset lactation, so it can take days and days and days for her milk to come in. In the meantime, the baby needs to eat something. A bottle is introduced as a temporary solution. However, this creates nipple confusion, and then the baby becomes reluctant to do the work of actually figuring out mom's breast. This leads to incredible frustration combined with a painful latch, sleepless nights, baby blues. All of this contributes to our abysmal breastfeeding rates. At the time of this video's recording, 83% of women want to breastfeed exclusively, but by 6 months of age, less than 50% actually make it. And you might be a unicorn who magically has no breastfeeding issues whatsoever, but that's not the case for most. I had a very difficult breastfeeding journey with both of my babies, and I'm so thankful that I opted out of the epidural, because I don't think I could have continued if it were any worse than what I went through. Fortunately, I got past that hump, and both Josephine and Colby got a great start nutritionally. And even now, Colby is 11 months old, 2 days ago, and he still nurses day and night. Just look at this chunky boy. Clearly, something isn't working. Okay, I hope this video served to inform rather than scare you. There is a time and place for labor meds, absolutely. And if that's the route you want to take, I support you and your informed parenting decision 100%. Obviously, my niche is natural childbirth, but my ultimate goal is to help all parents make educated decisions for their pregnancy, birth, and postpartum journeys. I hope you liked this video. If you did, you're gonna love my other stuff, so hit subscribe to get the information you need to have a positive and unmedicated birth, and I will see you next time.